I'm Marta Moreno. I'm a clinical neuroscientist working to develop new approaches for the treatment of neuropsychiatric disorders. And today we are going to talk about neurodegenerative diseases and neurodevelopmental disorders. Neurodegenerative disease is a condition that the name means neurodegeneration, means that this is a disease that gets worse over time. It's a disease that comes in the brain and the brain starts losing tissue. So there's a continuous loss of brain cells, and that causes loss of function associated with it. So with the fMRI-guided TMS, the functional MRI combined with TMS, by mapping the brain networks and pinpointing the areas of the brain that have already started degenerating, you can guide the electromagnetic pulses to those locations and you can reactivate the tissue. And with doing that, you can obtain two gains. One is to activate the tissue so the tissue reconnects again with the rest of the brain, so you can compensate for function loss. And by doing this, you can delay the progression of the disease. And also you can recruit new areas of the brain that are not affected by the disease into the pathways that you are building through the stimulation, so you can also compensate for that function loss in cases in which certain areas of the brain have already lost all the tissue. In neurodevelopmental disorders, which are disorders that affect kids during their development, are conditions that prevents the brain to develop properly. So there's a slowdown in the maturation of the brain, in the building of the pathways, the activation of certain areas of the brain, and that comes with an arsenal of symptoms, specifically important in autism, which is a severe condition that affects at all levels, cognitively, emotionally, socially, affects families. So in these cases, sometimes affects even language development and comes with a lot of cognitive impairments in cases. So with this technique, again, you can map the brain, you can pinpoint the areas of the brain that are slowed down when you compare with healthy brains, and you can stimulate them. And by doing that, you're going to rebuild the pathways, or build the pathways that are not being built. You can increase the neuroplasticity, you can improve the overall brain activity. So over time, you can really help this brain to mature properly. These conditions respond the best when treatments are delivered over the course of the years during the neurodevelopmental phase of the brain. And we have many examples of kids coming to us with no language, with the social awkwardness and withdrawal, with many of these cognitive impairments that prevents them from achieving academic goals, that once we start with these treatments, and over time, those that can receive the treatments over time, we can really change the trajectory of these brains and have these patients discovering a new brain and discovering the new opportunities and that this artificial stimulation is giving them those activations that by nature they are not having. So both neurodegeneration and neurodevelopment are conditions that can now be treated with TMS.
I'm Aliar Kangarlu. I'm a physicist working on the imaging technology. And while neurodegeneration sounds like a disease, it really, human brain goes through neuronal loss starting the age of 25. So this is not something that happens only to old people. Of course, for what happens to us after the age of 25 or 30 years old, lifestyle changes or lifestyle adaptations can really slow down the neurodegeneration, slow down the neuronal loss. Let's call it neuronal loss when you're young and neurodegeneration when you're old. And for instance, people who have more cognitively intense lifestyle, learn new languages, learn new skills, don't live life on automatic pilot or mindlessly, and as we all have a tendency of calling those conditions as the conditions of recreation. In other words, when we are not doing anything, our brain is not trying or struggling through something, those are the moments that we enjoy the most in our lives, not knowing that, whenever your mind, your brain is in that state, could be really the state of neuronal loss. And whenever your brain is active, just like, if you think about your neurons, just like your muscles, if you work out with your muscles, you will have very strong and healthy and big muscles. if you don't work them, you've all seen bodybuilders in the latter parts of their life when they stop exercising. What happens to their muscle is comparable to what happens to our neuronal cells. We lose them. In neuroscience, you don't use them, you lose them. As simple as that, whether it's your muscles or your brain cells. So understanding of the mechanism of neuronal loss, understanding the mechanism of neurodegeneration is very important. And in Neurotherapeutix, not only you treat patients, but you actually educate them because of the demand of this technology. People become very curious about how this technology works, and through the explanation that you make to the patients, you actually educate them about something that even a 25-year-old can use it. Basically, you can use it at any stage of life that you are, both for the treatment, the way that this treatment gains efficacy, and the way that we live our lives. And the more cognitively demanding life we have, the more healthy brain we will have, and we will really delay the onset of any brain diseases as a result of active, healthy lifestyle.